can I ask you whether we did check for antibodies for any other vaccine that we take?
We don't.
We just get the vaccine and we trust that the vaccines work. So we do make antibodies in response to vaccination. We make antibodies in response to infection. Now, the commercial assays that are out there measure antibodies to either the spike protein or to the nucleocapsid protein. So in the early days of the pandemic and the early days of vaccination, a lot of people were calling me up and saying, I've had 2 doses of vaccine, I have no antibodies, what shall I do? Do I need to take a 3rd dose? Very frequently, the people who were calling up had actually gotten a test done that was measuring antibodies for nucleocapsid when the vaccine that they had taken was the spike vaccine. So obviously, they wouldn't have had antibodies unless they had been infected with the virus before and had not known that, right? But even if you measure the right kind of antibodies, it's possible to take 2 doses of vaccine and not have measurable antibodies. Now, the important thing to understand is that these tests were not made to figure out whether you were vaccinated and whether you're protected or not. These tests were made for the purpose of serosurveys to figure out whether you've been infected before or not. And even if you wind up not having these antibodies on these tests, that does not mean that you don't have protection. Another thing that's important for people to understand, because a lot of people who follow the science are now reading the paper and saying there's something wrong with the vaccines that are being used in India, because see, in the paper it says 98%, 99% of people made antibodies, and I know of a dozen people that have gotten both doses of the vaccine and don't have any antibodies. What's the likelihood of that, right? It's because, again, you're using the wrong test. The tests that are being used for the vaccine trials are tests that were designed for the vaccine trials. They are not available as commercial assays at this time. There is one particular test that is coming in as a test that can be bought, but no clinical laboratories are using that test at the moment. And the basic thing is, when you make antibodies, your test that is intended to detect infection will have a reasonably high specificity. They don't want to label someone as infected because that's a false positive. When you look at tests that have to be to see whether the vaccine produced an effect, you're looking instead for sensitivity. What's the lowest level of antibodies that I can measure? So the tests are designed for 2 different purposes. And what we wind up measuring in the vaccine trials is really, is there antibody or not? And even when we measure these antibodies, we are actually measuring antibodies that are binding antibodies. They are not functional antibodies, right? They show you, okay, so a binding antibody to a spike protein will be an antibody that can bind to the spike protein, that can stick on to the spike protein. But what we are interested in is not just binding antibodies, but antibodies that actually neutralize the spike protein, which is they are functional because they stop the spike protein from doing its work. What is the work that a spike protein has to do? It has to bind to the ACE2 receptor and help the virus to get inside the cell. Now, if we can stop that from happening, those are the antibodies that are called neutralizing antibodies. When we are infected or vaccinated, we make a lot of neutralizing antibody. We also make a lot of non-neutralizing antibodies, some of which are the binding antibodies. There is a relationship between the two, but it's not a perfect relationship. So when we look at antibody responses following vaccination, we need to be very clear about what we are measuring and why. So even if you look at binding antibodies, people who get severe disease make higher levels of antibodies, and people who are asymptomatic make lower levels of antibodies. That's clear across a range of different assays. And in studies that have been done in a cohort at the Translational Health Science and Technology Institute, up to about 30% of people who had asymptomatic infections did not make antibodies that were detectable by the assays that we are using. Now, we know that that does not mean that you were not infected. That just means that you made such a low level of antibodies that the test couldn't find it. And we also know that a lot of people who don't make antibodies actually have a T cell response that recognizes the virus. So even if you don't have measurable antibodies, it doesn't mean that your immune system is non-functional.